Welcome back to Morning Joe as you look at a live picture of a rainy United States Capitol in Washington. Inside that building is where we find a member of the Homeland Security Committee, Republican Senator of Oklahoma, James Lankford. Senator, good morning. It's good to see you. I want to ask you specifically about your state. Began a phased reopening on May 1st, this past Friday. Do you think Governor Stitt of Oklahoma is going about this the right way by slowly beginning to open the economy?
Yeah, it's a slow beginning for us. Masks are encouraged, social distancing is encouraged, telling people that if they're high risk not to get out, this is not the time for them to be able to engage, but trying to be able to reopen some of the quote unquote non-essential businesses. The challenge the governor has is when you label essential and non-essential business, when you're labeled that way, is very difficult because if you own that business or you work at that business, it's essential to you. And so they are trying to be able to find ways to be able to get reopened. They don't have break rooms open in workplaces, trying to be able to do extra cleanings. So doing the things they need to do to be able to start slowly re-engaging this process.
What does a responsible reopening of the economy, not just in your state, but in the country, look like to you, Senator? Obviously, there are a lot of public health experts. We just heard from one, Dr. Emanuel, who worries about the reopening of certain parts of the economy and getting people into tight spaces and doing some of the things, frankly, that President Trump wants to do, which is to get people back to work. Everyone wants that to happen. They just worry about the pace at which it may be starting to happen. So how, in your mind, are you weighing that balance between public health and getting people back to work?
Well, I would say, first off, this is a difficult decision for everyone across the globe right now. Hong Kong is reopening at this point. Yep. People are wearing masks and reopening that. Many parts of Europe are reopened right now, and they're trying to slowly work their way through this process. So this is not just a United States issue. This is a global issue, as every country and every region around the world is trying to figure out how to be able to strike that balance. I would say the first thing is maintaining social distancing, hand washing, and wearing a mask as much as possible to be able to do is what we're going to do. Right now, I just took my mask off to be able to go live. I'm more than 6 feet away from the cameraman at this point. To be able to do that, I'll put a mask right back on as soon as we're done. So just trying to be able to maintain that in the workplace as well, to be able to help protect other people and your own family when you go home. That's important. But continuing to keep people that are high risk not engaged in the economy because it's especially difficult for them.
Senator, the president has discussed a lot about reopening the economy. Obviously, the economy is going to be struggling for quite some time. Nobody argues that it would be great to reopen the economy. But one way to get there more safely is to have national, uniform, mass testing available. Do you think the president should use the Defense Production Act to get it there, get testing in place quicker?
Yeah, I think we push as many ways as we can to get testing. The question now is not just testing, it's rapid testing. That's the big difference on it. At the beginning, it was trying to get any test out there. That test may take 24, 48, 36 hours to be able to get a decision back, sometimes longer than that, depending on the part of the country you live in. Now what we really need are those rapid tests that are 5 to 15 minutes so that you can get in any doctor's office, any hospital, and get a rapid turnaround. So the key is not just some testing, it's fast testing, and to be able to determine how you engage. You can't go to a hospital now without getting some kind of testing, and if you're getting testing 48 hours before, that's very different than when you walk through the door. We're going to test you immediately and to be able to determine what's happening right now in your system rather than what's happened 2 days ago in your system.
So do you think the president using the Defense Production Act would be the best way to get there?
I think whatever it takes to be able to get there. Quite frankly, and I don't know if there is a certain way to get there. Abbott Labs, lots of other folks are dialing up, doing lots of manufacturing at this point. That's a good thing. We're seeing people do a lot of overtime to be able to do production. Whatever we can do to be able to help press this, we should press it.
Willie.
Senator, we know Oklahomans, like many Americans, are having trouble getting either the PPP loans they may have applied for or even just unemployment insurance as they've filed those claims. More than 30 million Americans have done that over the last 6 weeks. How focused are you, and is it getting any better, on getting that money into people's hands through that massive sum of money, 2 of them actually, that passed through the United States Congress to get small businesses the loans they need?
Yeah, it's actually been a chaotic start on it, obviously. We saw the law pass, and then 7 days later, it's actually implemented nationwide in banks and credit unions, lending institutions all over the country. It's incredibly fast dial-up. For just my state, for Oklahomans, over $5 billion has come in Paycheck Protection Program. Tens of thousands of businesses have been able to take advantage of it in my state. So it's been very, very helpful to be able to stabilize small businesses, nonprofits, faith-based nonprofits, to be able to at least allow them to be able to keep their people from having to go to unemployment. That was the feature of the Paycheck Protection Program. When we actually helped design this thing, it was to try to help guard our unemployment system, because we knew there's no way the states have enough capacity to be able to have enough room to be able to get the people through this system. So if we could do the Paycheck Protection Program, people wouldn't have to go to unemployment. But we've seen the 30 million plus go into unemployment anyway from a lot of businesses all over the country. But we've also seen literally about 4.5 million businesses also take advantage of the Paycheck Protection Program. So bumpy and all, there are a lot of people getting access to those dollars right now.
Senator Mike Barnacle has a question. Mike?
Senator Lankford, it's been more than a month since the United States has had fewer than 1,000 deaths per day due to the virus. And the virus grows at a daily rate of in between 2% and 4% nationwide. And yet there has been disturbing anecdotal evidence, some found in polls that have been taken, that show an increasing number of people don't believe the virus is as dire a threat as many other people believe it to be that way. What's your sense of people in Oklahoma, what they think about the threat of a virus that has not hit your state as hard as some other states?
Yeah, so my state's right around the 300 death total. We have a population of about 4 million people, and so we've not seen as many deaths in our state. We maintain social distancing. We've been pretty aggressive on those areas, and we're starting to recover a little bit faster to try to re-engage with the economy. The challenge that people have is with the flu, you know people that have had the flu or you've personally had the flu. With coronavirus, at this point with COVID-19, you don't know as many people that have had it if you're in an area like us, so you don't know the direct effects. So we're very dependent on the news actually being able to carry the story on that, and it's difficult for the news to be able to carry the human interest story because they're also trying to be able to maintain social distancing on it. So it's getting the message out. This is what it really looks like. This is how bad the symptoms are. To be able to say to one person, you may get COVID-19 and have little to no symptoms, and the other person may spend weeks and weeks on a respirator, or it may take their life no matter what they try to be able to do through the process to be able to maintain it. So the main focus that I have in trying to communicate to people is, hey, we need to be aware that you may be carrying the virus at some point, and so you've got to be able to guard other people. But if you get it, you've got to be able to treat this consistently. And the challenge that we have is every week or so, there's a new set of symptoms that come out as we find out this virus doesn't present itself the same way to every person every time. And so it is a unique medical challenge as well to be able to diagnose and to be able to see in a person. Initially, it was shortness of breath and cough, and now we know it's a lot of other symptoms that may show.
Senator, I'm just curious, who in the White House working on this do you turn to for accurate information that allows you to give guidance on this for your state?
Obviously, CDC, Dr. Fauci, Dr. Birx get a chance to be able to turn to the basic data that everyone turns to. The entire country is having to make their own decision, mayors, governors, and such, for what's happening in their area. But everyone's asking the question, what does CDC say? Where are they? What do they propose at this point? And then trying to be able to make decisions. So my state, like every other state, is looking at the CDC to be able to see what are the clear guidelines. And then also with an eye to the rest of the world, what are they trying to do in different parts of the world as they experiment with this as well.
Senator James Lankford, thank you very, very much.